My name is Nangu, and today I'm going to talk about hospital-acquired infections. Hospital-acquired infection is one of the most common complications of hospital care, and is one of the top 10 leading causes of death in the world. Firstly, I will introduce how infection is transmitted. Then I will discuss the impact of hospital-acquired infection on patient safety and workplace safety. I will also talk about legal and ethical boundaries in nursing practice, but introduce the infection control policy and code of conduct for nurses. Lastly, I will highlight the goal of this presentation and summarize what have been discussed. Talking about hospital-acquired infections, we must understand how infection is transmitted. There are three main routes of transmission: contact transmission, droplet transmission, and airborne transmission. Contact transmission includes direct contact transmission and indirect contact transmission. Direct contact transmission means the direct personal contact between a susceptible person and an infected person. This is common between patients and nurses, such as when nurses perform personal care that require direct physical contact. It also commonly happens between two patients, such as shake hands. Indirect contact transmission involves contact of a susceptible host with a contaminated object, such as contaminated needles, contaminated gloves that are not changed between patients. Droplet transmission happens when contaminated droplets from the infected patient are propelled a short distance and dropped on a susceptible person's body. It usually transmitted by coughing, sneezing, and talking. Airborne transmission, which means the contaminated dust particles that can remain in the air for a long period of time. The contaminated air may be inhaled by a susceptible person over a long distance from the infected patient. Disease can easily spread and cause serious consequences if we don't take any precautions. Then let's have a look at the impact of hospital-acquired infections. According to research, large amount of Australian hospital patients experience hospital-acquired infections. In 2015, over 6,000 of hospital-acquired infections were diagnosed in Australian hospitals, which is 1 in every 74 patients. Hospital-acquired infection has a huge impact on patients' health and workplace safety. It results in a prolonged hospital stay, which is approximately 18.1 days longer than patients without this complication, and longer hospital stay would associate with higher cost. It also results in increased morbidity and mortality, as well as the risk of readmission within a year, which caused a great physical and psychological harm on patients. From 2015 to 2016, hospital-acquired urinary tract infection accounted for 26.6% of all hospital-acquired infections, which is the most common hospital-acquired infection. It shows a patient with a hospital-acquired UTI will have 20.6 days longer hospital stay than a patient without this infection. In 2015, over 70,000 of hospital-acquired pneumonia has diagnosis in Australian public hospital. Infection of surgical site happens in about 3% of surgical procedures. In 2015, over 5,000 patients have experienced hospital-acquired surgical site infection. In 2015, there was more than 15,000 of hospital-acquired bloodstream infection, and according to research, having bloodstream infection is 2 to 3 times more likely to die than those without this infection. Also, patients' mortality rate is 3 times greater if they have hospital-acquired bloodstream infection. Hospital-acquired infection has great impact on workplace safety and patient safety. It causes patients pain, suffering, and even death, and uses up valuable healthcare resources. It also increases nurses' workload and causes physical and psychological damage on nurses. However, more than half of hospital-acquired infection can be avoided. Now let's talk about what nurses should do to control the infection. Just as there are multiple causes of hospital-acquired infection, there are many strategies to address this problem. Effective infection control requires a range of initiatives at different levels. New South Wales Public Health Organization have published a mandatory requirements and the governance structure for health professionals. It's all healthcare professionals' legal obligation to comply with relevant regulation and policy in order to ensure patient safety and maintain a healthy workplace. Health practitioner regulation has mentioned that health practitioners must comply with the infection control standards, which focus on hand hygiene, use of PPE, and waste management. Hand wash should be performed before and after any direct patient care, and immediately after contact with body fluid, and before and after performing a procedure. Hand wash should be performed regardless of whether gloves are worn. Protective personal equipment include gloves, gum, mask, and protective eyewear, and should be worn if there is a possibility of being contaminated. Clinical waste should be packaged properly to prevent potential exposure of infection. Sharps such as needle, scalpel, or other sharp instruments should be discarded in a sharp bin immediately after use. According to Code of Conduct, nurses have responsibility to ensure patient safety and workplace safety. To achieve this goal, nurses should make sure policy, procedures, and protocols are implemented. For example, nurses should make sure infectious patients are isolated and appropriate format for prevention plans are implemented. In addition, nurses should also ensure the families, carers, and visitors have access to hand hygiene products and PPE to enable them protect themselves. Nurses are required to keep themselves, co-workers, and patients in a safe environment. Therefore, it is the responsibility of all nurses to teach, supervise, and assess students and other nurses to making sure the highest infection control standards are performed across the professions. In teaching and assessing the competence and performance of co-workers or students, nurses should be objective, honest, and constructive, and provide accurate information. Besides, nurses should develop a partnership with patients and take a leadership position in developing a hospital-acquired infection management plan. Nurses should inform patients about the purpose and progress of developing a hospital-acquired infection management plan and empower them to be involved. It's nurses' responsibility to improve their awareness of hospital-acquired infection, provide information for patients, carers, and families about prevention of hospital-acquired infection, such as teach patients about standard precaution, proper hand hygiene, and how to utilize appropriate personal protective equipment. This presentation has talked about how hospital-acquired infection is transmitted. Then it discussed the impact of hospital-acquired infections. It will prolong the hospital stay, increase mortality and morbidity rate, and increase healthcare costs. After that, it introduced the infection control policy and strategies that nurses should comply with to prevent hospital-acquired infections and in order to ensure patient safety and build up a healthy workplace. The policy includes perform proper hand wash, use PPE, teach and assess co-workers practice and educate patients about infection control preventions. Presentation is aiming to improve nurses' awareness of hospital-acquired infections. Not only nurses themselves should maintain a high standard of practice, but also it's important to assess students and co-workers to provide safe care and maintain a healthy workplace. It's also important to develop a partnership with patients and teach them about infection preventions. Infection control precautions is crucial to reduce the risk of getting hospital-acquired infections. As the registered nurse, It's our legal and ethical responsibility to comply with infection control precautions and teach other people to maintain a healthy and safe environment. Thank you so much for your listening.